and then would touch on a couple things, and then we'll.
We're Brian, we're live. We're good
Oh,
with
we
our
are okay.
guest. Yes.
All right, very good.
Okay.
Okay, thanks, Sarah.
Yeah, no, that's
Welcome,
okay.
everybody. Yes, well, welcome, everybody. Brian Calley, CEO of the Small Business Association of Michigan. You can tell that I've not been doing the briefing for a couple of weeks because coming in hot. But it's still going to be a really interesting show. We got lots of very weighty, meaningful, important things to talk about today. There's so many things that are happening. And as usual, joining me today is Sarah Miller.
Yes, thanks, Brian. Glad you're back with us. I want to start by welcoming one of our new members. They're Mighty Lube Systematic Lubrication. So they're a new basic member of ours. So welcome to Patrick, Brown, and team. So, Brian, you did mention a lot of weighty issues. We do want to kick off today's show with an update on the Board of Canvassers meeting from last week, Thursday. So, we sent some member communication out Friday morning, but we wanted to make sure we had a chance to cover kind of what happened last week, Thursday, and what we should expect going forward. So, I'll turn it back over to you for that update.
Yeah, thanks, Sarah. This is a really important issue that we will be spending over the next year or so. I expect a lot of time on. There is a proposal to amend the Constitution to institute a graduated income tax, and this graduated income tax would more than double the tax rate on many small businesses. And there's a petition, and it's kind of an us versus thing, and that's not how we think about things at SBM. We try to really avoid us versus them type situations, but they call it a tax the rich proposal. So the idea is you increase taxes like by a lot on some people and then use it to fund education. That's generally the proposal here. But what the language that the Board of Canvassers approved fails to disclose is that of the about 18,000 entities who would be impacted or tax returns would be impacted on this, 77% of them, so most of them, more than 3 out of 4, are small business owners. And the reason that this proposal for a graduated income tax hits small business owners so hard is because most small business owners pay their business taxes at the individual level. So, in other words, they're pass-through companies. They might be LLCs or S corporations, partnerships, sole proprietors, where their income from the business flows through, even if the owner doesn't take any income at all, flows through to the business owner's personal tax return. That's where the business tax event happens. You might imagine that it can make a small business owner's tax return look like it's high income or rich, as the proponents of this proposal say, but that money usually has to stay in the business because costs go up, benefits go up. They need to hire, they need to make capital improvements. They need to make loan payments, which the principal part of the loan payment is not even deductible on your taxes. So there's so many different aspects of the way that small businesses are taxed that can make their personal tax return look like it's high income, even if the cash flow reality of that business is very different. That's why we're very concerned about this one, because it might seem attractive to some people to tax people that make $500,000 a year on their personal tax return or $1 million a year on their personal tax return. If, but most people don't realize that for small business owners, the entire business income shows up on their personal tax return, even though it's not the wages of the business owner. So this is a really important thing for people to keep track of. Okay, so what happened last week? The Board of Canvassers failed to agree on summary language that would go on a petition. So, sometimes they sign a petition to do something. Well, this would be a petition to institute a graduated income tax. And if you were to read the petition language, it's not very descriptive at all. And they weren't able to settle on changes. And so we're stuck with the original draft from the elections director that unfortunately is extremely biased and in some cases downright misleading. And so we're concerned that people would read this 100-word description on a very extensive and very complicated constitutional amendment and think, oh, the description sounds good. Just tax the rich to fund education. That sounds great, except for that's not what it actually does. And it mainly taxes small business owners. And we're very, very concerned about this. So we have assembled, and I think Sarah just shared the link, a resource that you can look at, just a one sheeter, one piece of paper that can tell you about what this proposal actually does, who it impacts. And we're hoping that people will decline to sign the petition, that even if you read the petition language and you think, oh, that didn't sound too bad, if you actually, that's just a summary of the proposal. If you look at the actual proposal, you'll find out that it is very, very harmful to small business. And if it's harmful to small business, it means it's harmful to our economy. If it's harmful to our economy, then it's going to be bad for everybody, including schools. And so we're asking people, decline to sign this. And if you own a business, please take a look at our resource and share it far and wide, and hopefully with your friends and family. If somebody says, "Hey, sign um, this petition," that people will say, "No, thank you," and we'll see whether or not they get enough signatures to get it on the ballot. It requires over 500,000 for them to get it on the ballot. No easy feat to collect that many signatures, but we don't want to take anything for granted. So we want to be your source of truth on this proposal, and hopefully the resources that we're sharing with you started right out of the blocks will be a good tool for you to share with your employees, with your friends, with your family, and maybe defeat this thing before it gets out of the blocks.
Yes, we're planning to add some more resources to that webpage that I shared, that would make it maybe a little bit easier for you to share it with your network. So stay tuned or watch your email for more details there. All right.
All right. Well, we have a special guest,
Yes.
and I want to get to now for another important discussion. As you know, the Small Business Association of Michigan has been. We work in a lot of different levels in the healthcare area, both on policy and advocating for lower costs and high quality health insurance for our members. We've got a very long-term, productive, and important relationship that spans back decades, going back with Blue Cross Blue Shield of Michigan. And so our guest here is actually not new to the briefing. It was about a year ago. Yaniv Riban from Blue Cross Blue Shield. His title is Senior Director of Commercial Markets Medical Product, and he is here today to have a discussion with us. We're really going to focus in on costs. So Yaniv, thanks for joining us today.
Yeah, thanks, Brian. Really appreciate you and Sarah having me. Before I go any further, I just wanted to, first of all, acknowledge that many listeners today are either current or former Blue Cross Blue Shield of Michigan customers. So thank you for your business. We know that offering healthcare benefits is really key to attracting and keeping talent. And we're also very much aware of the cost associated with offering that benefit. And so thank you again for trusting us with this really important aspect of your operation. And so, as Brian mentioned, I lead a team that is responsible for designing and managing the medical products and the benefits that enhance our members, your employees' well-being, improve access to quality care, and really drive affordability. And I always like saying I work in downtown Detroit, but like many of my colleagues, here at Blue Cross Blue Shield of Michigan, I'm making a point to visit all of our offices across our great state of Michigan here.
Very good. Well, thank you so much for joining us today. Let's just get into this cost discussion and to kick it off. What is driving these days? What is really driving healthcare cost increases? And maybe just to make sure that it's useful and productive for our members, what sorts of things can employers do, or does Blue Cross do to help employers to manage these costs?
It's such a great question and a great starting point for our conversation today. It's really a set of systemic issues that are driving the continued climb in healthcare costs. Everything from an aging population, more chronic conditions, but also hospital consolidation and the rising price of treatments and medications too. I'll point to this one statistic here, and that is that hospital prices alone have increased more than 250% since 2000. So that's triple the rate of inflation. That's the healthcare cost equation, and it's really important. But many in this audience are going to feel the impact with premiums, right? What they pay to the health insurance company every single month, or what their employees pay to the health insurance every single month, maybe as part of biweekly paycheck deduction. And so it's important to understand why premiums continue to rise. And I'll say these increases aren't arbitrary. They reflect the rising cost of care that I just mentioned across the entire healthcare system. Now, we at Blue Cross and Shield of Michigan, we're a nonprofit health plan. And so we take into account the major factors like hospital consolidation, the higher procedure prices, and the increasing drug prices when we set those premiums. Those are all external pressures that directly affect what employers, you, and your employees might pay on a monthly basis. So we'll talk about what employers can do in depth in a minute here. Let me talk about for a moment what Blue Cross is doing on this front. And really, we view our role here is helping businesses and their employees navigate these cost pressures with more affordable plan options that don't sacrifice quality. And so along those lines, we offer a breadth of HMO, health maintenance organization, and PPO, and point of service or POS plan types, along with high performance networks. We're designed to meet the unique needs and locations where our employer base operates out of. And so whether the employer objective is lower monthly premiums, or flexibility to keep benefits the same, or anything in between, and we'll talk about all of that, we've got the options to meet those objectives.
Very good. So you'd mentioned HMO options and POS options. Like employees are pretty familiar with PPOs. I mean, it's many, historically has kind of been a preferred, if you will, if you're to ask many employees, but employers might need to control and cut costs. So maybe talk about the about those options, HMO options and POS options, and whether or not those are effective solutions, and what if anything are you giving up in choosing those types of options as a cost containment method?
Yeah, it's a great question. I think kind of like the key nugget there is it worth considering a point of service or an HMO option when I know and maybe even love, dare I say, my PPO? And the short answer is it's worth considering. And the headline I'll give here is that our research shows that employers can unlock significant savings to the tune of 10 to 20% off their premiums by switching from the PPO plan that they know and love to a point of service or an HMO plan. And let me break that down a little bit with some definitions and some numbers here. Now, the numbers I'm going to share are really averages. And so an average is not any single employer's numbers, but it is an average and representative. And so I think it's helpful. But consider the small business that really has only offered a PPO plan to their employees in the past. Keeping the same benefits of that PPO plan. When I say benefits, I'm talking copay, deductible, co-insurance, out-of-pocket maximums. Keeping those same benefits, but moving to a point of service plan, the employer can save about 12% on their premiums. They can take it one step further and move to a traditional HMO plan. Again, same benefits, same copays, deductibles, but an HMO plan type, they can save around 15%. And then taking it even one step further, maybe to adopt a tailored network, like our own PCP-focused HMO, which I'll talk about in a second here, they can get around 20% savings versus that PPO that they had in the past, with, again, the same benefits. So it's worth considering. Now, part two of that question, I often get asked, Yaniv, okay, great. Those are big savings, worthwhile for me and my income statement. What do I need to do to get these savings? What do my employees need to do? Well, When you offer a point of service plan, you get the flexibility that you enjoy with the PPO plan. The in and out network benefits and no referrals required to go see a specialist or a hospital. But your employees also commit to engaging in a primary care relationship with one PCP. So what you gain by moving to a point of service plan to get the 12% savings I mentioned earlier. When you move to a traditional HMO plan, you still agree again to have that primary care relationship with one PCP, and you also agree to let that primary care physician coordinate all your care to referrals and specialists via a referral. That's how you get that 14% savings I mentioned, or 15% savings I mentioned. And then if you keep on going and you move to a tailored network, like our own PCP focused HMO, that is where, again, you agree to engage in our primary care relationship with one PCP, and you choose to agree from maybe a narrower set of primary care physicians who are high quality and high performing and can deliver cost savings. So back to the question, yes, making a switch to an HMO or a point of service plan could be a trick to being able to keep your benefit package and maybe keep the premiums and the benefits in a spot that's right for your business. I'll add one more piece. Consider layering on a financial account like a health reimbursement arrangement, HRA, or a health savings account, HSA, to unlock even more savings and opportunities for your benefits package.
So let's dive a little bit deeper into traditional HMOs and PPOs and this concept of high performance networks. What is the difference between a high performance network and a traditional HMO or PPO?
It's a great question because more and more employers are looking at and asking us for health plans that feature that tailored network of providers or a high performance network. And I'll start off by saying these plans can be either PPO or HMO and are often centered around a geographic area. Say like Oakland, Wayne, and Macomb here in Southeast Michigan, or like around Kent County in the West. And what they do is they offer a premium savings for sticking with that geographic area and a subset of doctors and hospitals in that area when compared to a broad network plan. So that's kind of a definition of these tailored networks or high performance networks. I'll give an example, and that is our own PCP focused HMO network that we offer at Blue Care Network. It is a curated HMO network built around a subset of top performing primary care physicians in many regions of the state. These PCPs, primary care physicians, are selected based on quality and cost efficiency, which allows us to offer those plans at a lower price and employers to pass on premium savings to their employees if they so wish. What's unique about PCP Focus, as its name suggests, is tailored and high performance around primary care physicians, whereas still all the specialists and all the hospitals that are available in the Blue Care Network, HMO network, across the state are still in network. So it's a very streamlined approach that really helps lower overall costs while also supporting access to care and strong health outcomes. And the last piece on this is going back to a geographic area. Our PCP focused HMO network is a great option for small businesses and their employees that are located in the 20 county service area that make up the service area for the PCP focused network. And I'm happy to share that starting in 2026, we'll expand that service area to 31 total Michigan counties, which really allows so many more employers to take advantage of those cost savings associated with that network. Those 31 counties are broadly across kind of the middle belt of the state. So think top of the thumb on down to the southern border and across. And then there's a region that we're opening up in the Traverse City area as well.
All right, very good. So if lots of options, lots of different things to consider, how would, small business owners, they're running their business every day. They probably don't have like an HR person on staff or something like that. How would somebody really go about evaluating these options and figuring out what's best for them, what's best for their employees?
Absolutely. It really comes down to understanding your and I'll posit a couple of rules of thumb here. If you have an employee base that travels often or is distributed across the country or has complex medical conditions, you may want to choose that PPO plan that again offers the flexibility to get care and offers that nationwide coverage. If you have an employee base that maybe is a little more stable in their health, maybe they're only located within Michigan and value that lower monthly premium, that is where that HMO plan can be a great fit. And then in the middle there is kind of the point of service plan. If you've got a little bit of each in your employee base, you've got some stable health conditions and based in Michigan, but you also have some maybe folks that travel or live out of the state of Michigan. That's where a point of service plan, which is kind of that hybrid PPO HMO, may be a great fit. Now, what I'll say is for many employers, we strongly recommend offering multiple plans and allow the employee to choose what fits their lifestyle. Now, again, there's that choice word again. We've got a lot of tools here at Blue Cross Blue Shield of Michigan to support you and support maybe your agent if you use one, like our enrollment kits and plan comparison guides to help employees make the right health plan choice for them. I always like to share that making a change in benefit offerings for your health plan is really two steps from an employer's perspective. Number one is choosing the right health plan. That's a big step. But number two, maybe even bigger, is helping employees understand and get comfortable with the new benefit offerings. And I'll share a stat. I came across a survey by Voya, a big kind of employer payroll assisting organization. And they cite that 91% of employees choose the same health plan year over year. And so if you're making a plan change in order to manage costs or anything else, there's a big employee education component there. And we've got a breadth of tools and resources that we can share with you or your agent to help you along those lines.
All right, very good. Now, Yaniv, one more question. And we talked about options, lots of directions, how to evaluate these options, according to characteristics of employees in the workforce. Beyond plan selection, what or is there anything that that employers or employees could do to better manage their healthcare costs, or are they just along for the ride?
Yeah, absolutely. There's a lot that an employer and a small business can do kind of in the plan year to help manage costs for their employees. We encourage promotion of when it's right to use preventive care and establishing a primary care relationship, even if you're not in an HMO plan. Encourage employers sharing how to use telehealth and how to choose an urgent care over an ER. And also, we really encourage employers to encourage their employees to sign up for the Blue Cross online member account. It is a really convenient tool available on mobile websites, desktop websites, and of course via app, where employees can go and get real-time cost estimates for any procedure or any service they might have done, or understand where they might be in their deductible or what a copay might look like. And so those are the tools that we really suggest that employers promote to their employees throughout the year.
Very good. Well, Yaniv, thank you so much for spending some time with us. It's been a real hot topic the last couple of years, especially in maintaining good quality access to healthcare, but also controlling costs at a time when it just seems like the cost of everything is so much more than it
Yeah,
used to be for small business owners. Appreciate you and Blue Cross, everything you're doing in partnership with the Small Business Association of Michigan. Thank you.
thank you for having me.
All right. Yes. Thanks, Yaniv. So we have a couple of other stories to cover today. Let's start, Brian, with some other big news from last week where we saw some downward revisions on the jobs report. How big of a warning sign is this?
Yeah, it's a pretty big warning sign. I've never seen in since the pandemic, I haven't seen such a quick change in mood in terms of expectation toward recessionary fears. We were picking up on this already and a pessimism among our membership. And this is the first like big report that has happened that would suggest that there is softening in the economy to go along. This is not unusual for us. We oftentimes will hear from our members things that show up in the statistics 6 months or a year later. And so I'd put this in that category. Last year there was a jobs report that was positive for last month, but very modest. It's in the data Monday, although I think we might run out of time. The but the bigger news was the last 2 months before that, there were downward revisions, and these revisions were big. Between the 2 months, over 250,000 down. Those months ended up being slightly positive, but very, very anemic. So that was kind of a jolt. It did provoke or elicit a rebuke from the president about the Bureau of Labor Statistics that published numbers before and then kind of took them back and revised them downward in a big way. You've heard from me some frustrations about how big revisions were a couple years ago or the last couple of years. But these were big. I mean, these total over 250,000 just over 2 months. That's highly unusual. And you put that together with the current month reporting or the July reporting, I should say, that was very anemic. And so that means 3 months in a row of barely positive jobs reports. That's lots of kind of accusations about what's going on here and some back and forth certainly in the political world about it, but really the sentiment that we've been picking up for the last several months among membership has been pessimistic. And that's different than a statistic, but this is really kind of the first broad statistic that matches up pretty closely with that.
All right, so let's talk about the Federal Reserve, Brian. A few weeks ago, before the jobs report was revised, the Federal Reserve held interest rates, and there was a little bit of controversy around that decision. We talked about it here. Do you think that changes the picture going forward?
It definitely changes the picture going forward. Before it was kind of even odds on whether the Federal Reserve would reduce interest rates in their September meeting. It is impossible for me to imagine a scenario where they don't decrease interest rates in September now. It seems like a given. They must. It is in their charge. They have to keep inflation under control, but they also have to guard against recession and employment and support employment. With these types of employment numbers now 3 months in a row coming into this September meeting, it makes it crystal clear. Before it was starting to feel uncomfortable how long they were leaving interest rates up. Actually, I don't trust my memory well enough now to where I actually went back and I looked at Federal Reserve decisions going back through the 1980s. And each time that they increased interest rates because of inflation, after inflation went down below 3%, how long did they leave interest rates high or at the high water mark, whatever it was? And the answer is in every single case, not as long as this time. Every case, literally, this is a truly unique. They've never had rates come down and kept inflation rates come down and kept interest rates this high for this long. Truly unprecedented. Now they're skittish because before they didn't act fast enough to guard against inflation. And so now they seem to be more afraid of inflation than recession. And it looks to me like maybe they kept rates, they were too slow to act again in reducing rates, and now maybe have contributed to instead of a soft landing, maybe a bad economy. So I hope that it doesn't come to that. But I think that this makes it absolutely crystal clear that it is past time to reduce interest rates. I will be shocked if they don't decrease rates in their September meeting, the next one coming up. One other thing on that, this last decision to keep rates level was not unanimous. somewhat unusual for the Federal Reserve to not be unanimous. So there was dissension among the Federal Reserve on whether or not to keep the rates higher already last time. Now with this jobs report, it makes it pretty clear. I will be shocked if they don't reduce rates at the next meeting. But I don't know is by how much. Will they go a half a point or a quarter point? I don't know, but I do know that they look late now.
All right, so you mentioned a couple of things that jogged my memory, Brian, that we had not yet shared our latest survey with this group. So I dropped the link here. We're going to close this at 9 a.m. tomorrow. So if you have time to take this, that would be great. So Brian, do you want to save Data Monday for next week or run?
Yeah, we'll save data money for that. What we're going to go over is it's the most recent inflation numbers and the most recent jobs report to just kind of get into and put them together. And I think you'll see that inflation is not the main concern right now. The economy is the main thing, and I was just going to demonstrate that with the charts. We'll get to that next week.
All right, thanks for tuning in, everybody. We'll see you next week.
See you next time.